Many women with early-stage breast cancer will no longer have to undergo extensive surgery to determine whether the tumor has spread. Dr. Peter Ostro explains that treatment is just as successful without the added surgery.
Many early breast cancers can be cured by simply removing the tumor. But to find out if the cancer has spread, we examine nearby lymph nodes.
So the lymph nodes are primarily a marker to help us define what's the chance that this person will develop spread and how should we treat her subsequently.
Breast cancer first spreads through tiny channels called lymphatics. Lymph nodes are found along these channels. If a marker is injected into the tumor, we can trace it to discover the first lymph nodes that it reaches. Those are called the sentinel nodes, and they would likely be the first place we would find cancer if it had spread. So the sentinel nodes are removed and examined. If they don't contain cancer, the cancer probably hasn't spread, so the primary tumor is removed by lumpectomy and the surgery is finished. If the cancer has reached the sentinel nodes, then the surgeon also removes the other lymph nodes in the area and under the arm. But is that necessary?
What about if one or two of the sentinel nodes are positive? Do we really need to remove the rest of the lymph nodes? And the answer for a long time has been yes, because other lymph nodes may be involved.
But a study reported in the Journal of the American Medical Association showed that the additional surgery isn't needed.
First of all, there's no difference in the long-term survival or cure rate from breast cancer, whether or not the remainder of the lymph nodes were removed. And furthermore, there was no difference in the cancer coming back in the area of the armpit lymph nodes.
So the surgery has changed.
We now know that we can omit the full lymph node surgery and spare them the added side effects of the full lymph node surgery.
And Dr. Edge estimates that just in Buffalo, about 150 to 200 women a year will not have to go through extensive lymph node surgery, all thanks to this report. And he points out that we owe a debt of gratitude to the hundreds of women around the country who participated in the study. They took a chance, and now many others will benefit.
Yeah, now what happens after this surgery? Does that treatment change as well?
Well, after the surgery, almost all the women in the study received either chemotherapy or hormone therapy or a combination, and that won't change. What's new is that we now know that those treatments work just as well without extensive lymph node surgery.
All right, quite a breakthrough. Dr. Peter Ostro, thanks for joining us tonight.